Moving forward, we saw a very exciting update with a drug called Tarlatamab that was in May 16th of this year, 2024, for the accelerated FDA approval based on a phase 2 study for extensive stage small cell lung cancer. And so what is Tarlatamab? So what you can see here is that there are proteins on the outside of small cell lung cancers. You can see here highlighted in yellow, the DLL3 protein. This is on the surface of the small cell. And what Tarlatamab does is it bispecific T cell engager known as a BiTE. And what it does is it interacts with the DLL3 on the small cell and it interacts with the CD3 on an immune cell, forcing them to engage, forcing them to see each other, and forcing the small cell lung cancer to be approached by the immune cell. How I'd rather you think about it is this is a super glue. This glues together the small cell lung cancer and the immune system to force them to see each other and to force the immune system to recognize it, to engage and kill the small cell lung cancer. The data that led to the FDA approval was the Delphi 301 study. This was a phase 2 study. There was a phase 3, meaning 1,000 patient study that is ongoing. These patients were randomized to one of two treatment arms, whether it was a 10 milligram dose or a 100 milligram dose. And what they saw was that patients who responded about 32 to 40% of the time, when they responded, it was durable. It was really over a year. You can see here in the top right panel that when patients responded, survival was maintained. And you can see that past 12 months, it really seems there's a flattening of the curves, which is what we want to see. The patients are doing well, they're alive and with their families. Now, as part of the approval on May 16th, there was a boxed warning on the package insert of this drug looking at the role of cytokine release syndrome and neurotoxicity. And because of those, the FDA and the company agreed to require at least a 22 to 24-hour observation in a hospital setting for the first 2 doses, cycle 1, day 1, and cycle 1, day 8 of this Tarlatamab infusion, as there is step up dosing from 1 milligram to 10 milligrams, which would then be maintained every 2 weeks from there on out. So what is cytokine release syndrome? This could be an array of symptoms that can look as simple as a fever, having flu-like symptoms, having fast heart rate, but it could be as severe as respiratory failure, heart failure, other organ failures where we may need to bring you to the ICU, provide additional support like oxygen, potentially even something like a ventilator to support you with medications like steroids and tocilizumab to help calm and cool down the immune system that is overengaged from that super glue. What we know about Tarlatamab is it is effective in patients who have brain metastases. You can see here, this was data that was presented and published earlier this year in our Journal of Clinical Oncology. And what we can see here is that patients had changes in known brain mets with the addition and treatment of Tarlatamab. You can see here that depending on the patients who had brain mets and received radiation, that they had deepening or shrinkage of their brain mets with the treatment of Tarlatamab. 87% of patients with pre-existing brain mets had benefit in the brain from Tarlatamab. And what we see is that really there's a nice concordance, meaning that what we see in the body is what we see in the brain, what's going on. So this is very hopeful because this can be a sanctuary site for small cell lung cancer. And we want to make sure we address the whole patient and not just one area.